Hello, everybody. Welcome to Grand Rounds. Nice of all of you to join us, and happy to welcome Dr. Barrett Fromme from the University of Chicago, joining us all the way from the roof of something. She will be talking today. She's a professor of pediatrics and a pediatric hospitalist at the University of Chicago Pritzker School of Medicine, where she serves in numerous leadership roles, including as the section chief of pediatric hospital medicine and the vice chair of faculty development in the Department of Pediatrics and the associate dean for faculty development in medical education. Always warms my heart when we have a med-pedsy kind of topic, given my background. Her interest in particular is her passion around mentorship and in the scholarship of teaching and mentorship, especially around career development and sustainability and gender bias in leadership and hiring. And we are delighted to welcome Dr. Fromme here today.
Thank you very much. I'm always excited to talk to my colleagues in New York because I feel like anything I do, I've been an adopted New Yorker. I was born in Yonkers, so it's in the water got in me, so it can't get away. People even in Chicago still say, "Are you a New Yorker?" I'm like, I'll take it. So I'm excited to talk to you guys today. Let me get my slides going, and we're going to talk about one of my favorite topics. And which might make me one of those people who just likes tilting at windmills, but I love talking about feedback and how we can improve how we give feedback, how we take feedback, and how we build a culture around feedback. And so that's really what we'll talk about today is culture and culture around feedback and learning from cultures that aren't medicine and how that can influence some of what we do. So we're going to talk about really the realm of coaches and players, and we'll see if we can apply some of what is known in that realm to what we do. And so this is going to be a broad overview in a sense, and hopefully you'll pick up different things that you haven't heard before. So my objectives, I'm an educator, love having them. So we'll talk about appreciating the essential role. We're going to differentiate between some types of feedback because the more I talk about this, the more I realize our learners are getting very savvy to this. And we'll talk about which one they seem focused on lately. And then we'll talk about the different roles. This is not a talk only for the attendings. This is also for any learner because we both play a role, both the feedback giver, the teacher, and the learner. We are all part of a dynamic. And so this isn't meant to just be to one of those two halves. And then we'll mention a couple different feedback tools you can use. So I have no disclosures, although the one thing I always like to say when giving a talk on teaching, though I do love teaching about teaching, is I am no better than anyone else at this. Every time I give a talk, I think, oh, I wasn't doing that yesterday. So this is a continuing learning process for all of us, including those of us who give talks in it. And then I wanted to hear a little bit about you. So it's always hard to do this, but let's go ahead and can you put into the chat if just who you are in a sense. Are you an attending? Are you a resident? Are you a student? Are you a nurse? Can you everyone just maybe type really quickly kind of who you are so I can get a sense of who's joining us today. Chief, good. 3 residents, I like they're together. All right, site chair of medicine, nice. Hospitalist, my people. A lifelong learner, Alfred, I love that. So, all right, hospitalist and APD, yeah. Anybody else going on there? Outpatient, all right, we got inpatient and outpatient. Interim PD, nice. All right, so we have a nice little, we've got learners. It looks like we've got different people in different medical education roles. Oh, new attending hospitalist. Graduated in July. Kevin, you came at an interesting time. Congratulations. So we have a nice little spectrum and we'll build up. And a Pritzker grad, solid. So you've already heard a little bit about me, but I'm agreeing with Alfred, lifelong learner, right? Hopefully we're all here because we're always trying to be a little bit better at what we're doing. But now I want you to look at this word, and I've already said feedback a couple times, but I would love to hear from each of you. What is your initial reaction, just in general, be honest, when you hear the word feedback? Like when you hear that word, what goes through your head? Oh, yes. Feedback is a gift, Matt. Now you're just sucking up to the crowd. I love it. And other thoughts? Absolute horror from the 3 residents. Thank you for your honesty, residents. I appreciate that. Right? The sandwich, we're going to get to the sandwich because I've got a new modern panini-esque sandwich for you. None of that stale white bread. Don't worry. It's hard to get people to tell you the truth sometimes, right? So that's that's a statement from the learner, right? It's hard. Well, it could be from both, but more traditionally, it's hard to get you to, I just want to hear the truth, right? And it's hard for the people giving it, right? Does anybody else feel tense a little bit when they hear the word? I know the residents feel horror. That's pretty extreme. Anybody feel tension or a little bit of anxiety when you hear this, when you hear the word feedback? Matt feels it's a gift. Matt Harrington says yes. Right. I think the emotions can be all over. I think in my brain, I think it's a gift, right? This is a wonderful thing. But even I talk about this I talk about this topic constantly. I still get that little pit in my stomach because feedback is critique, right? It's being told what you're doing well and what you're not. And we are all type A personalities. And so that can be stressful sometimes. And giving it, telling someone they're not perfect is also challenging. So we're going to hit on how we can maybe make this a little bit easier. So why do we do it? Why do we care, right? And here, it's the reality is feedback is everything when it comes to learning, right? Without feedback, you're just going to stay stationary, right? Instead, because feedback tells you where you are, where you want to be, and what the gap is and how to get there, right? It gives you direction. We know through studies that we are very bad at self-assessing and that we are very bad about like moving ourselves forward. And it allows people to identify those issues that they can help you, right? Because people can't always help themselves. And this is from a Romani article from 2016. And the hallmark of competency-based training in medical education is the optimal combination of regular formative feedback and learning opportunities for trainees to practice skills and improve performance. Competency-based education is all about moving on that continuum. And you can't move on that continuum unless you do something, have someone see it, give feedback, and then practice the next step. This is fundamentally why feedback is essential to what we do. So let's talk about the culture of feedback. And I will apologize to anyone who's not a sports fan. I am going to be a little sports heavy on the references, but I'll walk you through it if you're not a sports fan. And we have two different cultures. Does anybody know who the guy in red on the right is? The one yelling. If you know who he is, put the names in, put the name in there. My husband used to adore him. I finally convinced him he's not a great person. Who is this? Bobby Knight, exactly. So Bobby Knight, it was the coach of Indiana. He did great work with Indiana. They had great seasons, and but was famous for yelling at his players, yelling at the refs. He threw a chair. He gave a famous speech in which he swore and basically said people can kiss his blank. My husband was at that speech. He's very proud of that. So Bobby Knight, I would say, exemplifies that poor feedback culture in sports. And then you have this diminutive fellow over here on the left. Does anybody know who that young man, that older man, the tall guy we'll talk about in a second? Does anybody know who that is on the left? So that is John Wooden. And the gentleman he's with is Lou Alcindor, who you might know as his more modern name, which is Kareem Abdul-Jabbar. So John Wooden is, nice, Dan knew who it was, one of the greatest coaches in history. People still quote John Wooden for his philosophies about coaching. These were two different cultures, right? And though they both achieved success at some point, John Wooden certainly was longer. And I would say we would want our culture of feedback to be more of a John Wooden, a coach, a nurturing coach, a coach who's there to help you get better, not Bobby Knight, whose approach to getting you better is just yelling at you. I bring up sports because there's a fantastic article from 2014 that I fell in love with. And what they did is they did a qualitative interviews of people who were in medicine. So they were residents, fellows, graduates, some medical students who were not only in medicine, but they had been high-level musicians or athletes. These were not me playing ninth grade basketball. That was not who we were talking to. These were people who played in college, varsity, some Olympians, or musicians who had the level of concert skills. And what they did is they went and asked them about feedback. And they asked them the differences between their domain of either sports or music and medicine. And how did the culture of feedback differ, right? Because these are two areas, music and sports, that coaching and feedback are essential. So how does it differ? Are there differences? And what they found was that there are three things that influenced feedback. Two of them were across all three domains. And I'm going to talk about music and sports as one bucket because they were very similar. The learner impacts feedback. That's obvious, right? Like how the learner takes it, how the learner wants it, those kinds of things. The characteristics of feedback, and those characteristics were across domains. They were very similar. There was nothing different. We'll talk about some of those specific behavioral. And then the learning culture was the third. And this is the one thing that differed. And it was similar in sports and music, but it was totally different than in medicine. And there are a couple things that I think sports and music have that we can learn from. So one of the first areas was that there was a defined expectation of the relationship. And I love this quote. Well, in music, their job is to teach, and in medicine, their job is to treat patients and teach and do research and do a bunch of different things. And that's fine, but music teachers are teachers. That's what they're paid for. It's just to teach. This is an interesting thought, right? People who had lived in both realms were like, listen, I hired a coach. I hired a music teacher. We knew that was their job, but the students, the learners aren't hiring us, right? We're being hired to care for patients, even more so during COVID. We're being hired to do research. We're being hired to do all these other things. And even though in any major academic center, it's that tripartite mission, for learners, sometimes it feels like it's really the research and the clinical and not so much the teaching, or it is the teaching, just not the feedback. So we have a problem in medicine where we don't put it forth that this is an expectation of what we do. They also talked about the expectations of the feedback itself, right? When you get a coach or a music teacher, you expect them to tell you something, right? I love this. So there's a free rein to just say, well, you didn't do that, right? You need to do this more, right? Whereas I find that in medicine, people are less willing to give a step-by-step critique because it's less expected. You would, if you hired a coach and they never once gave you a piece of feedback, you would fire them. What's the point of being there? But if a physician or a faculty member doesn't give you feedback, you just go, oh, okay, it's not expected. So we have a problem not only with the expectation of the relationship, but where does feedback lie in teaching? Is it an essential component? And we can change that too. Directing attention of learners and teachers to performance, right? I love this. The common goal of your teacher and yourself is, of course, to just make the best music that you can, which is a really noble thing. It was always, for me, really hard to be truly offended by comments in music. So this was an interesting thing, right? They're saying when I'm in music or sports, it's all about performance and being the best we can be, but they did not get that feeling when they were working in medicine, which I would think if I asked you all, when you work with learners, what's your goal? You'd probably say my goal is to help them be the best doctor they can be, whether they're a medical school student now and a doctor later, or they're currently a physician, but that doesn't seem to have a shared piece. I've actually, since reading this article a couple of years back, started my rotations. When I start service for a week, I say to the learners, all of my learners, what's your goal? What's your number one goal of this rotation? What do you want to achieve? And they stumble. And then we eventually get to being the best doctor they can be. And I go, that is my goal as well. So let's just think of me as your coach to get there. I've tried to change that language because before that, no one thought that's why you're there. They thought you're grading them or you're doing different things. And then the modulation of learner emotion, right? People get very emotional in medicine when we give them feedback. I think it's partly because type A in medicine, we've gotten to this feedback stage, but we were in more of a grade stage. So you either got an A or you didn't, you got an honors or not. And that amplifies emotion. Whereas in other areas, it's really about getting better. So it's harder for me to get criticism during med school and residency. Sports I didn't mind. Maybe I expected them to criticize me. Maybe that was the mindset. So it's this idea that you're not expecting people to criticize you. So there's a lot more emotion. Now, I'd say, anytime I've been given feedback when I took piano years ago or played basketball in 9th grade, I still got a little emotion, but I never got really upset if a coach said, bend your knees more when you take the free throw, right? That was never, it didn't seem as a judgment on me, but it often feels like a judgment in medicine. Now, this is an article from 2016 that talked to, I believe it was internal medicine residents at was it Mass Gen? And they basically said to residents, what are your perceptions of feedback? So this could complement that information, right? And they say, to reinforce what we just learned, it lacks clear expectations, right? And the musicians and the athletes saw that. It doesn't facilitate honest feedback. So because of the dynamic between the attendings and people wanting to be nice, you don't really get honest feedback. And I think Matt mentioned that. It's not bidirectional. Now, this is where we divert a little bit from coaches and music teachers. I don't think a lot of athletes give coaches feedback on their coaching. They probably should, but they don't. And then faculty-resident relationships affect the credibility and receptivity. So again, this idea of maybe that's not what they're supposed to do and they're not known. Like, you hire coaches who are good at coaching, right? We can all think of people that would have been hired as a music teacher. You don't hire the person who's never played before. And so maybe that's, that credibility is threatened a little bit. But they all agree it's needed for professional growth, just like our athletes and our musicians. So this study really supported the prior study that these are some of the problems we have, but it is an essential component. So how do we do this then? So we know our culture is different. We know, I would hope, we think we'd want to have a culture that can really do this. And so how do we do that, right? And so this was an article from 2015 that talked about some ways to build this positive feedback culture. One was to explicitly teach learners feedback theory and methods, give feedback to learners who are self-confident, differentiate feedback from assessment, reinforce the feedback as a habit, have peers and faculty practice, and faculty can be role models. And we're going to focus on about 3 of these areas, although we'll touch on a couple other ones, because these are some simple things we can do. And I'm going to be honest, it's both at the ground level, but it's also up at the leadership level, at the institutional leadership level. So let's talk about players and coaches, or teachers and learners. I'm going to use, I had to put Chicago in there. My husband and I talked last night and I said, who would be the classic coaching and player combo from New York? And then our Chicago sensitivities couldn't even get us there. It was a struggle for us. So we're going to leave the Bulls on here. So the teacher role is a couple, right? Phil Jackson was a great coach. And some of the things that we'll talk about are role modeling, observation, and how we deliver it. So the teacher has some notable responsibilities in this dynamic. Sorry. All right, so role modeling. First, we have to role model informed self-assessment, but we also have to role model feedback solicitation. And informed self-assessment is probably one of those, major things we don't talk about enough because it's so inward. It's not really an external thing. I don't normally show people my informed self-assessment, although we can. So how do we do that, right? But then there's also feedback solicitation. And one of the things that's really important to note, and not enough of our learners ask for feedback. It's gotten more, I don't know if anyone's noticed, I've gotten more, I think it's the millennial generation, not to use generational stereotypes, but millennials really do crave feedback. And so they ask a lot more. Whether they want to hear it is a different story, but we need to role model that. We need to show that, hey, I want to get feedback from you. So having this idea of soliciting the feedback and showing people that I'm going to ask for feedback. How many of you, I would ask, have ever asked your learners before the feedback session? How many of you have ever told your learners on Friday or whatever day, I'm going to give you feedback and I'm going to ask you for feedback on my performance too? Slap it in there. I got one hand. Nice. It's hard for me to scroll through everybody. Maybe a handful, right? For those who've done it, has it been successful? Have you gotten feedback when you ask for it? You can put it in the chat or you can just talk. Because it's taking a chance, it's taking a risk. Has it been successful? Hard for learners to honestly give feedback to a faculty member, especially if you're the program director, right? It is, right? And why is it hard, right? Oh, I got yes, sort of, did not get a lot of feedback, right? Did it last week, kind of caught them off guard, right? So I love that you guys are doing it and you're 100% right. It's hard to give feedback, but there are ways to solicit feedback. One of the ways I do, I've learned over time that if I just say, so any feedback for me, they're like, oh, you're doing great. We love you. Thank you so much, right? It's not very helpful. But what I do is actually at the beginning of every rotation, I ask people to list their I call them thing 1 and thing 2. They're 2 big goals. They want me, 2 big things they're working on that they want me to observe and make sure I give feedback on. I tell them the 2 things I'm working on. And I'll tell you, since I've started doing that, I don't get feedback on almost anything else, but they always do give me feedback on the 2 things I mentioned. Because the reality is there's not a learner in America, but there's a handful. But most learners will not go up to you and say, I don't think you noticed, but you're bad at this. But if you say, I'm actually working on this thing, this is something I've gotten feedback on in the past, and I'm not doing really well, I'd love for you to give me feedback on how I'm doing. 9 times out of 10, they're going to give you feedback because you've already identified the problem. So they're not going to shy away from it because they're just helping you. They're just coaching you. you've changed that culture, right? So feedback solicitation is a big piece. Let's talk about informed self-assessment though, right? This is a big thing we have to do more, and our learners do too. And this is Donald Schoen's model of reflection. He talks about reflection in action and reflection on action. If you are the kind of person who journaled when you were young, you're great at reflection. If you're me and have 15 blank journals that people keep giving you and you keep putting in a closet, you're not a good reflector. But this is one of those things we really have to do. For me to be able to say, I'm struggling with these two things, could you give me feedback on it? I need to be able to reflect on that. Now, maybe it's just looking at my evaluations, or maybe it's reflecting in action when I'm on rounds or after rounds and I just feel like it's not going well. What could I be doing differently, or where am I struggling? Or maybe it's the reflection on action after you've gotten an evaluation or after you've sat with and realized that the time didn't go really well, or that clinic didn't really go well. So it's taking the time to have these reflective moments, because then you can self-assess and feed that forward to your learners and ask them for tips. I got 2 evaluations once in the same year that I was scary. Intense is fine with me, scary is bad. And I spent a good 2 years asking my team to notify. I was like, I'm working on this. I don't know what it means because it was an evaluation, but can you tell me if I'm scary? And it took 2 years, and finally a learner stopped in the middle of things and said, that was it, Dr. Fromme. And I said, what was it? And they said, that I think I wasn't scared, but someone could have been scared. And I said, well, what was it? And we finally got down to it. So although I couldn't solve the problem, my reflection was able to tell me there was one, and then I could move forward, and they helped me solve the problem to some extent. So again, solicitation, you have to initiate the dialogue, but I would say at a higher level, we need to set institutional expectations that this is something we expect our learners to do, is to give feedback, right? And you expect your faculty to ask for it. We need to make it this culture of coaching, this culture of working for growth, rather than just being timid about not improving, right? The number of times I hear that a faculty member is X, Y, or Z, and I say, well, did you give feedback? And they say no. And then, well, you want me to facilitate? No, right? We need to make it an institutional expectation. And this is a great quote about feedback solicitation. It sets up this culture of bidirectional feedback. I'm going to give you feedback. You're going to give me feedback. This is how we do things. This is how we get better. I've been doing this 15 years and I can still get better. If you send that message, I think it makes it much easier. So if you tell them this is all growth, this is about growth mindset, and I know it's being overused, but the Carol Dweck book is a pithy little book that's amazing. If you show that, right? And all too often, instead, we show that we are attendings and we are perfect. Look at us, right? We don't need growth. We're there. But instead, if you say, we're still going on the spectrum of competencies, I'm still trying to improve on certain things, then it's going to be easier. Third thing you have to do is observation. You really need to, or second thing you need to do is observation. You need to watch people, right? To give feedback, you have to see it. Now, I don't watch everything. But if I'm going to give, one of their goals is I want to take a more efficient history, I've got to go watch that history. If one of theirs is presentations, well, that's easier. I'm always doing presentations. If it's how they interact with families, I've got to go do that, right? So finding those opportunities for observation, whether that's a procedure, an interaction with families, with their nurses, but really finding the time. I think it's a little bit easier sometimes in ambulatory because you go in rooms a little bit more consistently. I just have rounds sometimes. So finding those opportunities to observe. And then we'll talk a little bit about delivery, and to do delivery, we have to talk about types of feedback. There's 3 ways I contextualize it: brief, formal, and major. Brief feed, well, we'll go backwards. Major is that midpoint rotation. It's going to be 20 to 30 minutes. Honestly, this is my feedback Friday when I'm on for a week of service. I block the whole afternoon because I have 8 learners and I've got to get through it. And I normally have to still do some on the weekend. But this is what we'll talk about with the feedback sandwich model. And it's a little bit more interactive. Formal feedback would be a little shorter. You still ask for self-assessment, but it's normally at like the end of a clinic day, or at the end of after a mistake, or after like a shorter, it could be after an ED shift, right? Those are really good ways to do formal, also a little bit private. And then brief feedback, I'm going to be honest, this is what learners love now. They used to not get any feedback, and they used to not get any feedback. And they were fine if they got anything. Now they get the feedback Friday, and now all they want is brief. And this is daily, quick feedback. You're not asking their opinion, their perspective. I actually do this in my domain is as soon as someone finishes a presentation and we're moving to the next patient, I tap them on the shoulder, I bring them back, walk behind the group, and I go, this is one thing I really like that you did, do it again. This is one thing I think you could change for next time. And they know they're going to get that feedback from me at least 1 or 2 times a day. Now that we're COVID and have smaller teams, I actually text it to them because sometimes they're on Zoom and sometimes they're not. But everybody knows they're going to get this really quick thing. So they're not waiting till Friday to get that major feedback and going, well, I wish you would have told me 5 days ago. You're doing these little things. And then I can actually sit there and say, well, I told them every day and they didn't get better. Versus every time I told them something, it was fixed for the next patient. The amazing learners literally fix it the next patient they present that day. And so this is what the millennials crave quite a bit, right? It's not overwrought, it's not overdrawn. It's like, that was good, that wasn't, keep moving. So focusing a little bit more on this can help your learners if you're not already doing it. All right, so let's talk about a few delivery methods. There are a bunch. I'm going to talk about 3 of these. There's the Jack Endy model, which is a 1983 article that's never gone out of style, as it should not. The Ask-Tell-Ask model, which is the new feedback sandwich. There's something called R2C2 in pediatrics, and then we'll talk about feedback scripts. So Jack Endy is simple. He just talked about principles. It was 1983 again, that the feedback should be specific. Read more is not specific. Read more what? Harlequin romance novels? I don't know. Instead, saying what you need to do is try and read one current article, or for us, it would be Pediatrics in Review, which is a great thing. Read one pediatrics review on a new general pediatric problem that you see admitted, right? So very specific. It needs to be based on behaviors, not personality. One of my stories that a friend told me is she was from the Midwest and she was a senior resident in Chicago and her intern was from New York. You guys will love this. And she said she couldn't put her finger on it. She wanted her feedback to say, stop being so New York. And she was like, but I realized I couldn't. That was like personality. It's a New York thing. You can't get the New York out of a New Yorker. And so then she broke it down to what was the behavior that the New Yorkerness may or may not have been influencing. And so she was just very quick and direct and didn't give time for the patient to really respond. And so that was really what it was. It wasn't being a New Yorker. It was just this behavior. And so the behavior was easy to fix. It should be well-timed and expected. So know you're going to get it on Friday, or tell them they're going to get a little piece of feedback every day from you after rounds. It should be regulated in quantity, never too much. No judgments. So don't say, I notice you're lazy. That's not it. It's, I notice you come late to work every day. Lazy is a judgment. Coming late is a fact. It invites their perspective. So this is more the feedback Friday. Tell me how you think you're doing. And then it only uses firsthand information. So Jack is like, anything we're going to talk about across models, this still applies. Then you have the Ask-Tell-Ask model. So the old feedback sandwich, which I know I'm with medicine people, but I'll still try not to swear. The poop sandwich, we'll call it, was give them something positive, tell them something critical, and then give them something positive again. Many people hate that because you just don't even hear the positive because you know the negative's coming. I always said I wanted kind of more of an open face sandwich. I just want the meat, and then you can tell me something nice. Instead, we have the Ask-Tell-Ask model, which says, ask the learner their self-assessment. I start every feedback session with, tell me how you think you're doing. Tell me one thing you think you're doing well, one thing you want to keep working on. And don't ask how do you think it's going? They're going to tell you they love the rotation, you're great attending. One thing you think you're doing well, one thing you want to improve on. If they've given me their thing 1 and thing 2, their goals, I can say, here are your goals. You may want to comment on those, but it may be something else entirely. Then I tell them what I think, and I'll definitely confirm or deny the 2 they said, and then I'll give them more from my perspective, both regulated and having some positives and some negatives. And then I ask them, so what is your response to that? Does it seem valid? And if it does, now let's think of a way to help you. Let's think of a plan together of how we can improve X, Y, or Z. Because the last thing you want to do is tell them they're not doing well and say, see ya, have fun, good luck. Because I've never met a learner who could do it well and is just playing around and thought they just would do it poorly that week. They're not doing well because they don't know how. So they need a plan from you. So the big piece is this third, so it's called Ask, Tell, Ask. The third part, the ask how they think, how they responded to it, and ask how we can make it better. That is that partnership. And that's the partnership where you really need to spend some time. Although coming up with a plan can be difficult. Because of that, and Pediatrics, a group and I put together feedback scripts. And the idea was that it's fully within the Ask, Tell, Ask model. What it is, though, it helps you with the tell part and the second ask, because that's where we stumble. A lot of times people go in with the best intention, but then the words just don't come out. So we've talked about scripting. This is based on teaching scripts from Val Lang, who's a hospitalist. They wrote in 2012, but this was piggybacked off that. And so this idea is that what's the behavior? What is the correlative milestone? So what is the, internal medicine ACGMA milestone that's related to that behavior? What's the evidence? And this is really that's the milestone, but if you keep being mean to nurses, nurses will never work with you again, kind of thing. Come up with a strategy you can suggest so you don't get to that plan part and go, I don't know, what do you want to do? Here's a plan that I thought worked, right? So the classic efficiency one, a plan could be make check boxes. Everybody likes to make check boxes for some reason. And maybe they never tried that. But I just gave feedback and they were like, listen, I've tried check boxes. And I'm like, okay, you tried check boxes. Let's think of a different plan, right? And so we came up with some other ones. And then you actually script how you're going to say it so you don't get in and stumble and bumble around. Because all too often when you start to stumble and bumble, that is when the words never come out and you never really give them the feedback they need. So we've actually published some of these online that are applicable. The idea being that we see the same behaviors over and over again. So those are just 3 really quick models, and they're not really separate models if you think about it, right? Jack Endy gave us the principles. You put them in the ask, tell, ask model, and the scripts help you with the tell and the ask portion of the program. And I can give resources to all of those. The other thing we want to mention is the difference between formative and summative assessment. And every time I talk about feedback, somebody says, well, you know, I feel badly writing an evaluation this way. I'm like, whoa. That's evaluation, right? So when we talk, you have to differentiate. There's formative feedback, and that's what we're talking about with ask, tell, ask. That's what we're talking about with all that. This is the idea of there's still growth to be had. Now, for me, at the end of a Friday, yes, I'm going off that week, but they're still on. I'm actually passing on that formative feedback to my partner who comes on and they follow up. So they're still building, right? So it's how, when you're on this 1-month rotation, this 2-week rotation, whatever it is, how can I give you feedback in the moment, right? That brief in the moment feedback. How can I give you feedback at the end of the day? How can I give you feedback when I'm going off service that helps you continue to build? And most of what I've been talking about is that formative feedback relationship. The thing that probably handcuffs all that is that you have to do a summative assessment at some point. So that formative assessment, formative feedback, leads to summative assessment. And that's the evaluation. That is where we say, in their time with us, this is where it ended. And this is where you can reflect on, and we gave them formative feedback and they improved. We gave them formative feedback. They improved some, had to do more. We gave them formative feedback. They didn't change at all, right? That's more the summative assessment. And although it's important to all the program directors, yes, we need them. But I'll be honest, the thing that changes behaviors more tends to be the formative feedback. And so really, you can't give the summative unless you've been working on the formative. And no one will get better to change their summative unless you give the formative. So making sure we know the differences between that. And when people are talking about this kind of feedback, it's not the written summative assessment. It's that verbal formative feedback in the middle of rotations. All right, now that's everything the attendants have to do, but I know we got a handful of residents on here. So the question is, what can you be doing? I think you probably already heard some hints to it, right? So we're going to talk about self-assessment for you guys. It's the exact same. You need to be looking at yourself and saying, what do I think I'm doing well? What do I think I'm doing poorly? Solicitation and utilization, and then upward feedback. So we did a qualitative study of challenges and barriers to feedback. We interviewed students, residents, and attendings at 3 different sites in different specialties to find out kind of how we could improve solicitation. Because one of my colleagues said, I know you teach how to give feedback, but do you teach how to ask for feedback? And so the product of that is the first thing you have to do as a learner is reflect on your own performance. You have to say honestly with yourself, not with ego, is how have I been doing? What are your strengths? What are your weaknesses? In pediatrics, we have an individualized learning plan, which is where we say things we want to work on and what we're going to do to work on that. You cannot go into any feedback session without having that done. If you go into that feedback, and we've all met those learners, you're like, how do you think you're doing? I don't know. You have to have a good self-assessment. And it's a good skill to learn because when you're at our level, if you're a faculty member, we've just said, we don't get feedback a lot. So if you're not self-assessing and you can't do it well, you're not going to be able to grow. And then you solicit feedback. And some of the drivers we have for this is have good timing. Don't run up to your attending when they're about to go to the bathroom or they have to run to some meeting and say, can I have feedback right now? Instead, on the first day, say, they haven't said when they're giving feedback and say, oh, Dr. Fromme, I was wondering, could I get some could we sit down and do feedback on Friday, right? If they haven't identified that. Be purposeful. So don't just say, how am I doing? Go back to your strengths and weaknesses and say, I was working on these things. Can you tell me how I've been doing in those ways? If you really want to get ahead of it, you tell them on day 1 you're working on these things, if they don't ask, And then you ask again when you sit down. And you have to have an open attitude. All too often we go in and it's a fixed mindset with we're going into feedback to get confirmation of what we're doing well. You have to go into saying, I'm open to whatever they're going to give me, right? And then different ways you can facilitate it, ask them to observe. If you want to get feedback on your history taking, and that's not something your attending normally does, ask them to join you for one. Ask very specific questions you want them to answer. And then feel free to utilize email, like email them and ask to schedule the feedback session. If you're worried about how your note writing is, email them a draft of one of your notes and say, could you give me feedback on this note? Make it easy for them and make it specific for them. And when you do that, right, you have a better chance of utilizing it, which I don't talk about here, but there's a whole process for then how you analyze that and check concordance with what you think and those kinds of things. So these are some barriers that people have noted. The best feedback I've gotten is when I've been proactive. So in this study from Romani, that is one way they got around the barrier. So again, that supports the idea of you need to go ask for it. And we're not always, this is an attending, we're not always thinking about what each resident needs the feedback on. To be directed by the resident, I think is terrific. It doesn't happen much, but it's wonderful when it does. So faculty are thankful if you do this. And then upward feedback, again, this is that culture piece. If I'm asking you for feedback, then this is easier. But be willing as a learner, if your attending says, do you have any feedback for me? Or I've been working on X, Y, and Z, be honest with them, right? If faculty are asking you that question, they really do want to change. So, don't walk up and say, you're the crappiest attending I've ever seen and you should never work again. That's probably suicide. But do say, well, actually, one thing I think that you could do more of or do better, or one thing I've noticed that, I think would make the learning climate better, just feel free to share with them, right? Again, faculty can change this culture if they ask for it more and respond to it appropriately when they get it. All right, we mentioned earlier, one of the things they recommend doing is feedback as a habit. So this is one of my favorite stories. I love Harvard Business Review. I find things that apply to my career often. And this was a story about the Other Side Movers. This is a company, I believe in Toledo, that there's a Harvard program that basically uses Harvard MBA folks to help released felons build businesses. So these are all former felons. And this one company started, the Other Side Movers, and it was all felons that had gotten out of prison. And so it's the toughest of the tough. I wouldn't say a high-risk crowd for employment. And they basically had two rules. One was 200% accountability. This was the idea that they were responsible as an individual employee for giving feedback the second they saw someone need it. If you saw someone out on a job moving and they were like speaking to a female client in a certain way that you thought was inappropriate, you don't wait. You pull them aside as soon as you can and say, that's not appropriate. Hey, this is our job. We need to behave a certain way. Their culture of feedback was 200% accountability. It doesn't matter who you are, it doesn't matter what role you have to give the feedback if you see something going well or you see something that needs to be corrected. And then they had something else called pull-up games, and they would do this, I think, weekly, and they'd sit around in a circle and they'd basically tell each other if I had a problem with something somebody else was doing, we'd get it out in the air, we'd all respond and we have a conversation about it. It worries me, a circle of felons telling each other how bad they were doing. But it's that idea that this company set the expectation of feedback. What's interesting about this company is they became $1 million company within a couple of years, and they continued to grow. It was a really great, for someone who would have invested, they would have thought this is an insane idea. That culture really built them so they were always providing optimal service and no one was slacking and no one was not growing. And so feedback as a habit comes from the top and it comes from the workers as well. And so we all need to do that. And when someone gives us feedback, take it and say, how can I learn better? The question is, does it work? Does any of this work? Not a lot of studies on this, but CHOP actually in 2007 did a cultural analysis for the institution, the educational aspect of it. And a couple of the recommendations they had after doing qualitative interviews, Doran Balmer does great qualitative work. You had to distinguish between evaluation and feedback. Not enough people understood the difference. And we already talked about that, right? Formative and summative assessments are great. One checkbox for you guys today. Increase the awareness of brief feedback. Nobody was talking about brief feedback. They were talking about Feedback Fridays. And so they wanted to increase that awareness. And they wanted to, this is shift from performance to learner-oriented feedback. So I don't know why it says performance choice. So this was the idea that you were shifting your performance from performance to learner-oriented feedback. Sorry. So this was the idea that it wasn't just trying to get feedback to say I was doing well, but what does the learner want to know? How does the learner need, what does that specific learner need to learn? And it may be something to do with performance, but it wasn't just about being, like getting that A+, right? It wasn't just someone validating you, and they had to move that feedback to that. And so this was their model, right? So you can see this thing start. They started with ideal feedback context, so you had to be in the right situation. Here were the 3 key drivers. They implemented feedback training for faculty and residents. You're kind of getting that right now, but we have to continually do it. And then evolved and understand feedback and implemented a developmental assessment framework. So they actually did this, and by 2017, they had a significant improvement in the culture of feedback as described. They repeated the qualitative assessment 10 years later, and people understood things a lot better, and people really looked at it as more of a growth situation rather than just, I'm getting a grade or someone's judging me. So to summarize, because I wanted to give enough time for you guys to have questions. As players and coaches, we need to learn to self-assess, and we need to learn techniques. I did a steamrolled version of some of those, but if you want resources to any of them, and I'm sure you have faculty development programs, we do feedback training at least once a year that we offer from the medical school to all faculty. Some days we have half-day retreats. We do specific to departments. We do teaching consults so we can go watch people. There are all different ways people can learn techniques, but you have to have those resources out there. If you go to national meetings, one day we'll go back to national meetings, there are also always programs on that as well. So go learn tools and techniques. Team culture has to change, right? We have to set a value for bidirectionality. We have to value that everyone can give it to each other, and there is no hierarchy when it comes to giving feedback. And we need to share goals. And I didn't say this enough, but I alluded to it with my thing 1 and thing 2. It is much easier to set a culture of just everyone giving everyone feedback is if everyone is telling everyone what they want to work on, right? You can imagine that if, as an athlete, I hired a coach and I didn't say what I was working on at all. I'm like, whatever, just tell me how to be better. That's a little bit harder for a coach than saying, I'm defense is my problem, and I do particularly bad in the post, right? That could be easier for a coach to address. So having that self-assessment lead to sharing goals is ideal. And then organizationally, we need to educate, we need to encourage, and we need to put a value on this. We need to prioritize this as important by even having a grand round speaker on this topic, and not something that involves a pipette and some sort of gel. Says your institution prioritizes it. But how do you value it? It would be great. So this is a little story about value. This is Carlos Beltran, who played for the Astros, and he's a bad example because I know the Astros cheated, but this was before we knew that. So he was actually a guy who had been an amazing player in baseball, but he had settled at the point in his career there's like wins above replacements, basically this idea of where you sit. He was average. Like if you compared him to anyone else who played in his position at that point, he was an average player. And Houston, though, decided, and there are these metrics guys, which is really funny. They were big metrics guys, but they said, the metrics tell us we could get someone a lot cheaper and who does the same thing, but they didn't necessarily need him for the field. What they wanted him for was for the culture. They thought he would change the culture in Houston, which was not really a great team up to then. And they paid him $15 million, which was so far above market based on his replacement value. They gave him $15 million for 1 year to come change the culture. And I won't get into all the things he did, but the Houston Astros will tell you he was essential to flipping the culture of, and not the culture of cheating, but flipping the culture of what they valued there and those kinds of things. So when you value it and you take that risk, it really does make a difference. Now, I am not promising anyone $15 million from your boss. That would be so great if someone paid me $15 million to change the culture. Not going to happen. But if we value it by giving time to get training, if we value it by having more conversations about it, then we too can elevate ourselves beyond where we were. So finally, culture is the myth is that culture is top down and it depends on leadership, but it really belongs to all of us. And we can push the culture change from the bottom. We can push the culture change from the top. All of us have to have a part of it. And so I want you guys just think for a second of a commitment you can make. What can you do in the next 2 to 3 days, the next time you're on service, next shift you have, next clinic you go to, next time you work with a learner? I want you to just take 2 minutes to write down what you can do from what you've heard, what change you might make to contribute to this culture. So write that down for 2 minutes or 1 minute, whatever you like. And while you do that, I'll just say thanks to all my teachers and all my learners. I've been fortunate to have exceptional ones on both ends. And I'm happy to take any questions.
Excellent. Thank you so much. So we'll open the floor for questions, either through the chat box or by unmuting yourself. Maybe while we're waiting, I'll ask a question about sort of leadership. I mean, I was thinking about sending out like a 360 evaluation or something to try to figure out not just what I think I should be working on, but what other people think I should be working on. How do you feel about that in general? And is there a way for people who, you know, in all different roles to sort of get a sense on what they're, I mean, I understand your push to have them, you know, people give feedback on what you think you're working at, but how do you find out about what you need to be working on that you didn't even realize was a problem?
Yeah, so the 360, I love that you said, I love it. I actually went to my chair. I think we talked about it about a year ago. And I said, I think all section chiefs, so we have section chiefs, not division chiefs, should have a 360. And his initial reaction, and it told you a little bit about his culture, was, I don't know. I don't think we can do that. And I said, well, I understand for like a section that's got 2 people in it, but we could batch. But like a section that's got 25 people, I think an anonymous thing would be great. He's like, I don't know. I don't think the section chiefs would like that, which tells you about them more than anything else. So I went and I went out on my listserv of hospitals and said, does anybody have a 360 that they use? Because a lot of these are you pay for. And somebody sent me one they use in their department. And I actually sent it out to I have 10 people in my group. And we have a community director just under me. And I had her do it too. And it was fantastic, right? It was a really good anonymous way of getting areas like I might not, and it was overall a good evaluation. So it was like really, you know, piece of bread from the feedback sandwich. But there were a couple little points I was like, oh, that's something I really could work on. You have to be willing to make the changes, because the worst thing you can do is send that out and not respond. But I definitely think, although I love the formative feedback and the communication, if there's any concern, having some sort of anonymous survey is a really great way to do the 360. I'm a huge fan. I will go back to my chair again and again and again until he lets me do it, because I just think too many of our, as much as I want to say the culture of feedback is easy, people won't tell their bosses stuff, not always. But that also will change your culture, because people will be like, oh, he wanted me to tell him what I thought. And that might start to roll it if they see you do it and respond. Then maybe they'll get really comfortable coming up to you. So I think it's a really good start for sure. Is anybody doing anything they think others could share? I find best practices are always kind of the best thing. Is anyone doing something they think has really helped the culture of feedback on their teams or in their practice?
Dr. Fromme, thank you so much for your talk. I really enjoyed it. If I could just make one quick comment, one thing that I found, you know, really interesting about your talk is the idea of, you know, how to sort of break down the power differential between, you know, the way that, you know, typically, you know, you have a faculty member giving feedback to a resident or to an intern. You know, that is a situation wherein, you know, as Dr. Steinberg mentioned in his comment earlier, was that sometimes it's very hard to get that bidirectional feedback because of the inherent difference in power between one party and the other. I found your suggestion about, you know, actually kind of making a recommendation about, you know, what you as the faculty member are seeking out in terms of feedback as an icebreaker, I think is a really valuable recommendation. You know, and you just mentioned about, you know, sort of best practices, things like that. I think that's definitely something that I'm going to start incorporating in my own practice. And I really thank you for that recommendation.
Oh yeah, I learn all these from other people and incorporate them, and then when they work, it's like, oh, that was probably one of the most notable things I saw change when I incorporated that. And I thought it was small at the time, but it's, it's, and I hate to keep using the thing, but I love the concept of coaching now, right? Not just from that article, but this idea of, if we all just agree we're trying to be the best we can be, then it's really not a power dynamic per se. It tries to take away that power dynamic. And it says, just help me be better, right? And there's all that movement to coaches. Atul Gawande wrote about it, and it's formal coaching scenarios, which is great if you have funding for it. My friend at Stanford has 0.1 FTE for 10 different coaches to like follow you for 3 years of residency. Not everybody has that. So to me though, it's built keeping those coaching behaviors in your boots on the ground, in the trenches behaviors. And I think this is like a coaching thing, although I always say, but coaches never ask for feedback. But the reality is coaches do, right? If what they're doing isn't working, they've got to take feedback from somebody to say, okay, I need to try a different thing. As a current Bears fan, our coach needed feedback. And I don't know that he got it, but we'll see. But then again, you guys you have the Giants, so I don't know. We're all in the same boat right now, aren't we? So I think that is a little bit. So thank you though. And it looks like Justin says, struggle with giving constructive specific feedback because he often forgets the details that occurred. Justin, yes. And Justin, I don't have a picture right now. I don't know how old you are, but like my mind, I can't remember anything. Yeah, so it does. I don't think it gets better with practice. I've talked to several people who used to carry little cards in their hands, and just each card was a learner. And just at the end of the day, they jot like, patient this is the thing. I put it on my iPhone. Like I just keep notes in my iPhone sometimes so that I can remember at the end of the week. Although one thing that's helped unintentionally is this brief feedback I give. I find I remember it better if I give the feedback to them. So like in rounds, something happens, I immediately pull them back and I say, oh, on that one, you did this well, do this differently. Somehow I remember that event better because I commented on it. So like at the end of the week, I go, remember like on Monday when I told you this with that patient, I think you did really well to build on that. So that was like, that was not why I did the brief feedback, but I find I remember it a little bit better. The other way is just to put, the iPhone, like I don't use my phone nearly as, and I'm sorry, I'm not selling iPhones, any smartphone, but like just put a note in the smartphone and then I delete it at the end of the month. I also keep, once they give me their goals, I make a Word document and put it on my desktop, and then I can pull it up on, through iCloud. And on rounds, I'll just pull it up sometimes and be like, what were they working on? Oh, and then I can pair what they were working on. It all just like reinforces itself a little bit. I don't know if that helped. Oh, good. And then, yes, sorry, go ahead. Anjali.
Hi.
Hi.
Thanks for that great talk. I really enjoyed it. I had a question about sort of giving feedback to folks that might not be directly under your supervision. I've come across this a lot of late where it's either, a night float resident that you're seeing an admission that was done overnight on, in which case, I defer to, using email and sort of trying to communicate that way. But something happened to me last week. I was on medical consults and I had asked for a cardiology consult, and the resident on the cardiology service left a note, and I was trying to give some feedback. And I'm like, how do I actually do this? Because we don't have a structured time and place.
Yeah.
But it's important as a learner for me to provide that feedback loop. So do you have any thoughts on that? I ended up doing it over Epic Chat, which I kind of was like, this is, cool. I don't know whether this is the right place.
You have two interesting scenarios, right? So night float we have that similar too. And it actually got to a joint anxiety. They wanted more feedback because they didn't feel they were getting it enough from us. And we wondered how to give feedback. So we actually now, when we're on service, we call in to the night team around 8 or 9 p.m. just to not run the list. Any questions about the patients? Hey, let's talk about that patient you admitted last night. And that's our little feedback window. It's not big, it's not fancy. It's done with the intern and the senior, but it's our way to give that little piece of feedback. And we just established that as a routine. I have done it when they weren't on the next night because they switched, and I will send email about it, but I'll tell them before. I was like, listen guys, I won't always see you the next night, or I won't have that opportunity. I'm just going to shoot you an email with feedback. And a lot of times they're really receptive to that. The cardiology, because they really aren't under you, I would just text them and say, hey, I was wondering if I could give you some feedback, right? Some may take it poorly, like, you're not my boss, but then the culture of feedback's not really there, right? So
Right.
I've done that when I was working, I used to work in an ED, and a surgical resident came down and was just a dip, I won't say it, but a bad person. He didn't do well. And I pulled him around the corner and I said, hey, can I talk to you for a second? He still hates me. He's married to one of my former residents, and I think he still hates me. But he needed it. It was a critical piece of feedback that he needed. And I gave him a little bit of the sandwich, but I think just having that say, hey, again, if the culture is there, oh, thanks, I didn't know that. You know, I'll do that the next time in my note.
Great, thank you.
Looks like there's a question in the chat about framing feedback so that residents don't see that it's too critical.
Yeah, so the too critical thing is interesting, right? I could say it would help if you projected your voice a little louder and one person would start crying. Or I could go up to someone and say, you're a complete buffoon and you need to get it together, and they'd be fine with it, right? A lot of times how critical it seems depends on the learner. Again, I'd say the biggest thing I do is I frame the whole rotation. I frame my whole week. Anything I tell you is only to help you reach your goal. That's all, right? So if I'm telling you something, it's not to judge you, and I'll say that, it's not to criticize you. It's really just to say, this is a behavior you can tweak, and here's how you tweak that behavior, right? If we take out the personality, if we take out judgments, it makes it a little easier. But if you reassure them of that, I've actually started telling students, I know I can't get rid of the grade. I hear you, and you're always going to think the grade is there. And that's why a lot of people get very nervous. But I want you to forget the grade for a minute and just focus on your own growth. So I just try to frame it like that, because I don't think critiquing is a bad thing. I want people to critique me, right? I want you, if I'm playing tennis and you're my coach, tell me to hold the racket slightly differently so my forehand can put topspin, right? It's like, I haven't played tennis in years, I should go do that. But I think framing it for why are you doing it, and that's the goal, then that helps people take it in a little bit more. And letting them know you're there to help them improve, not critique but like, hey, this is something I've noticed. I think you can do it differently. Let's see how we can work on it. And why don't we try it for 2 days and I'll give you more feedback. That I'm in it with you kind of thing. And if anyone does Peloton, I've gotten into Peloton, and like, they're always telling me, I'm here with you. I'm here the whole 10 minutes. Don't you worry, I won't let you down. And I'm like, oh, I know it sounds cheesy, but I'm like, they're with me. And then you think, of course they're with you. It's their recorded thing. Of course they'd be with you. But a lot of times I think knowing that you're not just going to leave them with the critique is helpful.
It sounds like a great message to end on. Thank you so much for joining us, Dr. Fromme. I really appreciate it.
Thank you guys all. Stay safe out there.